When I got the information from Rose yesterday, I was looking over the agenda. And when I read the first one, I thought, well, I that's not my area of expertise. And that made me pause and it made me stop. And I was thinking, why isn't that? Why don't you know any of this information? And so last night I went online and I did some research, and I had already known about the smallpox blankets that the military handed out to natives back in a war that nearly accomplished their goal of genocide of the American Indians. I was shocked when I read, I had never heard this before, that the numbers of American Indians in the country before the white man stepped on our land numbered in the millions. When smallpox was finished, there were 120,000. So I am one, ashamed that I didn't know any of this information, but another that really stunned me was the sterilization of women in the 1970s. Oh, I can't, I just can't begin to fathom that kind of abuse. And it just, um, it made me really grateful that we have organizations like this that are undertaking this responsibility to educate our community on how to protect themselves and how to know when a study is legitimate.
Kind of following off my dear friend Bill's just comments right now, made me think of this story that I've shared with, I think, Rose and Matthew before. And it's I was doing some work. We were actually doing some focus groups on positive Native parenting. And I was sitting with a group of elders who were advising us on, the traditional ways our children should be raised and our value systems. And it was during one of the breaks, and I was sitting next to this awesome elder. She was so great and so funny. And in the midst of that break, she leaned over and she kind of whispered to me, and she said, I was never able to have children. She said, I was sterilized when I was in the boarding schools when I was about 14 years old. And she had like tears in her eyes, and she was looking right into mine. And as she held my hand, she said, but I would have been such a good mother. And then she said to me, but at least I got to be a good auntie. And we held hands and cried for the rest of our break together. And I'll never forget that moment. These stories are told throughout our communities of the harm that has happened. And at the same time, the strength that still lives there. So she talked about what a great auntie she was. And she provided some of the best advice on how we should be raising our children, because she had really put all her love and her effort into that for her entire life. Those historical harms have to be talked about. We have to acknowledge them. We have to acknowledge Havasupai was very damaging, not only to the Havasupai community, but to all Native people because of that research harm. In Alaska, when they injected villagers or Aleut people with radioactive materials, that was harmful to our communities. Those stories are still told. We always look to the past to help inform our present to build a stronger future. And we also have to acknowledge that in those harms are also the stories of the Native people who not only survived, but thrived despite all of these obstacles. And that there are so many Native people today, despite all of these, who have looked towards building systems that ensure people can make good informed consent, that we are represented in the evidence, that we use those missteps and past harms as a way to identify where we need good protections for our people and where they need more information.
When I think about everything that you guys are sharing, I kind of want to say that it wasn't until the Havasupai case that I personally thought about the long scale of how public health and Native health were interacting. And when I saw that, like there was a recent thing where the president said, you know, if we have a vaccine, we're going to use the US military to get that out to people. And I just thought that's that horrible history, right? That the first Indian health service, so to speak, within the Bureau was to protect the soldiers because they didn't want them to get those diseases. It wasn't to protect Native people. And I feel like the public health component has been used instrumentally over time to ensure that that happened. The sterilization of Native women was because they were captives in that health system, and that was done without their consent for purposes of alleviating the burden on the government, right? We didn't want all of these children to have to be burdens on the government, and that happened to other minority women as well who were in poverty. And it's happening right now. People say to the immigrant women that are detained in those ICE facilities. I don't know if that's true, but that's the mantra, that once you're in that system, they really don't care about you. They'll study you, they'll do what they want to do, and maybe they'll tell you, and maybe they won't tell you. My question is for all of you, that's the fear that I hear from communities, like when the All of Us Project asked some of our Native students at the university to participate, and some of them were urban, right? And so they felt that that was a permissible thing. But then people started to lock down into that and to remember Havasupai, because that was such a big thing in Arizona as well as nationally, but it's still a big thing in Arizona. People were like, well, you're not going to exploit the Native students. Like, that's wrong. You know, they should go to the tribes and ask them if they want that. So I think the issue that I'm having a problem with in your work as health professionals is each of you has extensive experience and leadership that I don't have. How are those assurances made today that those unethical practices can't happen, that there won't be a higher order priority for public health at the expense of Native health, and that the interests of tribal governments as sovereigns today can be protective whether their members are on the reservation or off the reservation? I have a sense that people say things like that, but I don't know if you can actually point to the policy or the law that says all of those past things cannot happen in today's world. And here's why. Look at this law, look at this policy, look at this practice. I don't know if that's possible, but that's what my question is for you guys.
These informed consent documents aren't really there to protect the participants. They're there to make sure the researcher doesn't do anything bad to the participants, which is a difference. I think if these documents were meant to help the participants first and not just allow research to happen in the most ethical way that we know, they would be a lot easier to read, a lot more simply written, and a lot more direct with more direct language.